So I'm going to just wash my hands prior to meeting. Lisa, hi, my name's Tammy. I'm a nurse here with Rowan University. Lisa Long is agreeing to doing a video assessment of the head, neck, and eye regions for demonstration purposes on YouTube. Are you okay with that, Lisa?
Yes.
So my name's Tammy. I'm going to be here to assess you. We're going to be, like I said, doing the head, neck, and eye. The first thing we'll do with the assessment is we're going to assess the hair. We're going to look that there's even distribution of the hair throughout. Lisa, do you have any history of headache, blurred vision, nausea, vomiting?
No.
No. Have you ever had any head injuries?
No.
Any difficulty swallowing?
No.
And have you ever been diagnosed with a vertigo, unsteady walking, or unbalance?
No.
No. Okay, so we'll go back to the hair. We're looking at the even distribution of the hair, looking at the texture of the hair, making sure that the hair is intact, and it is. We'll go ahead and assess the scalp, looking for dander, any type of larvae. We're looking for deviations in the scalp, any pain or nodules, and nothing is felt on Lisa. We have a normal finding here. As we go down, we're again assessing the hair. We're looking for equal distribution of the hair, eyelashes, and in both cases, Lisa's are evenly distributed throughout the region and equal. We'll go down the midline looking for symmetrical on both sides. Lisa, can you smile for me? Tongue out? Okay, thank you. And so what we see is that both sides of the face are symmetrical, tongue's midline. We're assessing cranial 7, looking for possible palsies, Bell palsy, maybe a stroke of any sort. Go ahead and click, open your mouth and close. Do you grind your teeth at night?
No.
So that's really important for assessment to make sure that there's no structural issues with the jaw. We'll go back to the skin. Lisa's skin's clean, dry, and intact. She does have freckles distributed evenly throughout her nose and chin and forehead. I don't currently see anything that's raised, hardened, discolored. Any areas on your face that aren't healing, or
No.
any history of that. It's important to have follow up with dermatology to assess areas that are changing, so that if Lisa does regular exams on her face and notices any change in any of her moles, she wants to follow up with that. So we're going to move into the eye. One of the things we're looking at is the sclera. We're going to look at the sclera, the iris, and the pupils on both sides. And again, we're looking for the color and tone, looking at the lacrimal ducts to see if there's excessive tearing in the eyes. And Lisa's not demonstrating any of that. One of the 6 cardinal views of gaze is doing testing for the muscles of the eyes. And so we're going to start out by doing that. Lisa, if you can look at my finger and follow it. We'll come down, back to center, and then we're just looking to see that both eyes dilate equally and move in equally, and Lisa is demonstrating that correctly. We have the direct and the consensual light test, and by doing that, we're looking at Lisa's eye, putting the light on, and then in the opposite eye, we see the same demonstration of the light, and Lisa's is correct. And then we have the confrontational test. And by doing the confrontational test, we are assessing Lisa's peripheral vision. And so I'm going to start out here and come through.
Now.
Okay.
Now. Now.
Okay, and for demonstration purposes, I did it both eyes at the same time, but typically we want to cover one eye and do the peripheral test and come in.
Now. Now. Now.
Okay, and we will repeat that on the other side. Lisa has demonstrated good peripheral vision. So we're going to go ahead and assess Lisa's the Snellen chart. And we'll do that for eye testing. Lisa, we're going to start on line 6 for time restraints. If you can put your glasses on for the exam. So we'll start by covering your left eye. And if you can read line 7 for me.
Line 7, F-E-L-O-P-Z-D.
Okay, and we're going to move down to line 8 with that same eye.
D-E-F-P-Z-D. P-O-T-E-C.
Okay, and if you can switch to the other side. And we'll go start with line 8.
Line 8 is D-E-F, P-O-T-E-C.
Okay, very good. And Lisa's demonstrating a 20 out of 20 through the Snell chart. And I'm saying that incorrectly. The Snellen chart test. And that is a positive 20/20 vision with her glasses. It's important that Lisa, you can leave your glasses on,
Okay.
Lisa. It's important that you have your eyes test minimally every 2 years. But if you are noticing any nausea, headaches, any changes in your vision, you want to do that sooner. So we're going to move on to the lymphatic system. And we're going to start with the occiput. And in assessing the lymph nodes, it's really important to start off with a gentle touch using your first 3 fingers and just gentle, small, little circle movements, looking for abnormalities. And typically you don't feel anything, or it's very soft and pliable. If I were to feel a hard fixed, or Lisa were to complain of a tender area, that's something that would be of concern and need follow-up. Lisa, if you can just let me know if anything's uncomfortable. So we're starting with the occiput. We're going to move forward to the posterior auricular, and then coming forward to the preauricular. Okay, and then we're going to move down. And I'm going to do this for purposes from behind because I feel that I can get a better assessment. The submandibular nodes, the submental. We're going to move down to the jugular dodastic, which is the tonsil region. Superficial clavicle, the deep clavicle. Lisa, if you can turn towards me. And we're going to turn you this way. Thank you for... it's important to turn the head towards the side that you're palpating, because it's a very deep lymphatic node, and it's very hard to palpate without turning the head, and it just makes it easier to feel. And then we're going to go to the posterior cervical, supraclavicular, okay, and then the periorbital gland, which is just below the cheekbone. Most of the lymph nodes are assessed and named by the region where they are located. So then we're going to come down and we'll look at the neck. And in viewing Lisa's neck, you're looking at this midline of the trachea. The trachea is midline from the chin straight down. As you can see with Lisa, everything is intact in that region. There's no lumps, bumps, as we felt with the lymphatic system. Lisa does not have difficulty swallowing, and you've never had any surgery or issues with your neck.
No.
In palpating the thyroid, we're doing that right at the cricoid region. When we palpate you can either do it anteriorly or posteriorly, and I find that when you do it posteriorly, it's a little easier to assess. And an abnormal finding would be an enlarged thyroid outside of that region, any types of lumps or bumps or goiters, and you have none of that, correct, Lisa?
Correct.
And having the patient swallow sometimes makes it easier for assessment. So if you can take a deep swallow for me. And again. And nothing is palpated that is out of the norm. This completes our assessment today. I thank you for your time. Lisa, thank you for being with us, and have a good evening.